Hello, I'm Eric Skindred with the Hospital Association of Southern California. Today we're talking with Dr. Gregg Miller, Chief Medical Officer at Vituity. Vituity is a physician-owned medical staffing partnership with more than 5,000 doctors and clinicians. The firm is a HASC Endorsed Business Partner. As the voice of Vituity and a practicing ER doctor, Miller has been interviewed by NPR, Parade, Axios, and multiple other news outlets. He previously served as medical director for EDs at San Joaquin Community Hospital, today's Adventist Health Bakersfield, and at Swedish Edmonds Hospital in Washington State. First of all, welcome, Dr. Miller. Great to have you here today.
Yeah, thanks, Eric. Glad to be here.
Okay, now this is very interesting. Last week you appeared on an NPR segment that shared a hopeful projection that sees a relatively mild winter ahead of us COVID-wise. It didn't state the source. Do you know, was that the University of Washington's projection or maybe CDC's?
Yeah, absolutely. The CDC has a composite model that incorporates multiple different projections. And with respect to COVID specifically, they're anticipating that at least over the next month or two, COVID's going to be down. But the big question mark here is we just don't know what's going to happen with influenza.
Okay, well, so what do you think? Are we through the worst of COVID-19?
I hope so. I feel like you can never predict what's going to happen next with COVID. But with the increasing amount of vaccination and then the increasing amount of just population immunity from people who have gotten the disease, I think we're through the worst. There could always be a surprise. Maybe vaccination or post-infectious immunity doesn't last as long as we think it will. Or maybe there'll be a brand new variant that's out there that completely evades vaccination immunity or post-infectious immunity. But barring that, I think with respect just to COVID, we are through the worst, and this winter will be less severe with respect to COVID than last winter.
Well, before we go too far, tell us more about yourself and your role at Vituity, and a bit more on what Vituity does.
Sure. I'm the Chief Medical Officer for Vituity, so I focus on quality, on education, on risk, on clinician wellness, and on our data programs. And I'm a practicing emergency physician. Vituity is a large multi-state, multi-specialty medical group. We see about 7 million patients a year, and we've got several thousand physicians and advanced providers. We're in emergency medicine, hospital medicine, critical care, anesthesia, in the inpatient space. Outpatient, we do primary care and urgent care. And then we've also got a significant telehealth presence with telepsychiatry, teleneurology, as well as some inpatient psychiatry and inpatient neurology.
Next, in your clinical work and in Vituity's work across health systems, what are the biggest challenges facing hospitals today?
Yeah, Eric, that is a great question. And there's just so much on a hospital administrator's plate right now. But I think when you look at where things stand right now, we get so many conversations about population health and digital transformation and virtual front doors and new payment models and the shift from fee-for-service to value-based purchasing. I mean, there's so much out there. But I think we really have to focus down and drill down to what really matters at our core, and that's providing high-quality care. And when you look at some data over the past year, the CDC has put out data showing that quality has really suffered over the past year for very understandable reasons during this pandemic. But we're seeing more CLABSIs, we're seeing more CAUTIs, we're seeing more ventilator-associated events. The Joint Commission is reporting more sentinel events happening over the past year than ever before. And just, I think clinically, anybody who's practicing on the ground feels it, that we are just not delivering, at times, the high quality of care that we really want to be able to deliver. And it's very understandable why this is happening. It's been a very challenging time to practice medicine and to deliver healthcare, but it's something that we need to double down on and really focus on over the upcoming winter months.
Okay, as we move into the winter months, what steps can hospitals take now to prepare for possible additional surges?
That's a great question. Even though COVID is decreasing, I think we're still going to see winter surges, just like we do every winter, whether it's COVID, whether it's influenza, whether it's other respiratory viruses. We're just going to see more volume over the winter than we have been. And so to prepare for that, I think the number one focus needs to be on staffing. And hospitals need to start thinking now about recruiting for the busier winter months. How are we going to get more staff on board? How can we, maybe reduce the spend on travelers and use that to keep nurses and other healthcare workers in the system who are already here? And beyond recruiting, thinking about retention. And that, I think, is the most important. You're going to be able to recruit in a few individuals over the next several weeks to several months, but the bulk of your workforce that's going to be with you this winter, you've already got. And so how do we focus on retaining them? There's data out there that like 18% of healthcare workers have quit over the past year, and that includes, residential care workers and nursing home workers, but that's impacted the inpatient units as well. We see that when nurses quit, there's data out there looking at nursing retention. The nurses who are quitting the most are the ones who we really need. It's attrition from the ICU, attrition from acute care med surg units, attrition from emergency departments. That's where we're seeing the real nursing attrition. Ambulatory care, ORs, maternal units, they're not seeing quite as much attrition as we are in the more acute care settings. So we really need to focus on not just nurses, but healthcare workers in general, environmental staff, dietary staff, security staff, ancillary staff. We need to start thinking about retention.
I think you answered part of this question already, but this is a timely question and a very important one too. What advice would you give health system leaders to boost the morale of their frontline teams?
Yeah, great question. I think when you look at it, there's a couple things you can do as a leader. Number one is just be present for your team. Show up, walk around the unit. I mean, it does me as a practicing clinician, when I see my own hospital CMO down in the emergency department, it just feels good. And, for all I know, he's down there because he likes our coffee, right? But you just see your CMO, you feel a little bit more connected with him or her. You see your CNO or your CEO, just helps create a sense that we're all in this together. So I think that's number one, is be present and let your staff see you and make sure that they know that you know what they're going through right now. Another piece of advice I have would be change your family policies if you can. I think it is one of the reasons why it has been so tough delivering healthcare over the pandemic is quite appropriately we've restricted family access in an effort to tamp down on the pandemic. And that's been the right thing to do. But as we see more and more vaccination in our communities, I think it's time to let more families in. That will do two things. One is it offloads your healthcare staff because they no longer have to make calls to update the family. And two is, having that family there to advocate for the patient really makes a difference honestly, for everybody. It's great for me as a doc to be able to walk in and talk to my patient's, daughter or their mom or whoever else is with them. Really just kind of makes it for a more pleasant and meaningful patient encounter. So, and that'll just help with the work we have to do. And I think the last thing, I've got a personal mnemonic that I use when it comes to retention. And this is off of some studies that were done looking at medical staff satisfaction and healthcare worker satisfaction, what keeps people satisfied, what keeps people engaged. And there were 4 key behaviors that were identified. And I used the mnemonic CARE, C-A-R-E. C is for career development. A is for asking how to be better, asking how to improve. R is for recognition. And E is for education and information. So for career development, you really want to make sure that your team sees that they've got a future with your organization, that they can grow and have a long-term career with you. So they have to see that they're not just showing up to work today, they're building a career in your institution. And it's your job as a leader to make sure that the people you work with see growth within their careers. Asking is really important. That's the A in CARE. Asking, how can you be better? How can you improve? What does your team need to do a better job? I think sometimes we think we know all the answers because we've been there, we've done that, but it's a new world out there now, post-pandemic or in the middle of this pandemic. And we need to be communicating very clearly and effectively with our team so that we know what it is that they need. So just asking people for feedback and asking what we can do to make their jobs better is incredibly important. Also important is recognition, the R in CARE, making sure that you recognize some all-stars. And there have been, and I don't use this word lightly, there have been some real heroes over this pandemic. We've just seen some remarkable stories of sacrifice and of just amazing patient care being delivered by people under very trying circumstances. It's incredibly important to recognize our teams, however it is that you do it in your facility, whether it's thank you notes or posters or shout outs at meetings. Just make sure that you take every advantage you can to recognize. And then the last is to educate. The E in care is to educate or to inform folks. Just make sure that your team knows what's going on. We'll never get communication right. We're either going to over communicate or we're going to under communicate. And when we're in the midst of a pandemic, I'd say if you're going to err on one side, err on the side of over communication. Let people know what you're working through. Let people know what the hot button issues are. Make sure that you're out there in front of your teams, talking to them regularly about all the hard work that you're doing and the rest of the administrative and leadership team is focused on. So that's CARE, C-A-R-E, career development, asking, recognizing, and educating.
Got it. Okay, Dr. Miller, we're coming up on time. I think that's a good summary of Vituity and what's going on in the region and probably what's going on in hospitals everywhere. Is there anything else you'd like to share?
I hope your listeners know how much they're appreciated. I think we felt that at the beginning of the pandemic, but especially leaders in healthcare, I don't think you get enough thanks. And I want to make sure that you know that, our nation owes you a debt of gratitude for all the work that you've done. This has been the most challenging time in our nation's history when it comes to public health measures, at least in the past 100 years. And it's been really inspiring to see all the great work that so many different leaders in hospitals and in outpatient medicine, all that great work that's being done really makes a difference. So I just want to say thank you to all the listeners.
Okay. Thanks very much, Dr. Gregg Miller. Thank you and take care.
Thanks, Eric.